Hello. Well, in my presentation, I want to say something about the whole impact of COVID and where it might perhaps act as a catalyst for change in mental health. I also then want to look at some of the most pressing issues, I think, within mental health and looking also at some of the areas that are perhaps too often ignored in mental health and what the priorities should be for us going forward. So, first of all, we've obviously been through an unprecedented period over the last few months, and it's had a significant impact on mental health services. And I should say that, as both chair of the South London and Maudsley NHS Foundation Trust, but also as chair of the advisory board for a digital mental health company, ZenZone, which has a platform particularly for young people called Kooth, and another platform for adults called Quell. I've seen interesting developments over this period. So first of all, from the perspective of a mental health trust within the NHS, there was clearly a massive impact to start with substantial numbers of staff, around 1,000 being off sick with either COVID or self-isolating for various reasons. That immediately had an impact on our ability to provide safe services. So along with many other mental health trusts, we had to discharge a number of patients, a significant number of patients, back home early because essentially they were safer at home than they would have been in a ward, particularly because we ended up with COVID on pretty much all of the wards. But the wards, of course, had inadequate staffing numbers for the number of patients that we would normally have in inpatient care. So that inevitably had a significant impact on many individuals who use our services. What I've seen is an encouraging amount of innovation during this period. First of all, there's the rapid ramping up of digital consultations. It's really interesting that the facility has been there within the South London and Maudsley for a couple of years now, but it's been hard, as I understand it, to persuade people to take up the use of it. And then suddenly, almost overnight, the use of Teams to provide for consultations with those who use our services has happened, and there's been an impressive can-do attitude to that. Teams has also allowed staff members within a team to coordinate much more effectively than perhaps they have been able to do in the past. Regular morning team meetings using Teams has, I think, improved the ability for staff to support patients effectively. Then we've also had other innovations. So, for example, the chair and the chief executive, I'm the chair, together with the chief executive, have had twice weekly video conferences, live video conferences with staff. We've had between 400 and 900 staff attending each broadcast. Staff at any level in the organisation have been able to question chair and chief executive through the live question chat function, which has offered a degree of accountability and communication that hasn't been possible in the past, which I think has been really interesting. Then there's also a development, a digital innovation at SLAM, which is called Beth. But what it allows is it's a platform that allows patients to communicate with staff, with their clinical team. And just to read to you some of the highlights from what it offers, it enables an individual, someone who's using our services, to see who is in the care team and the support network, to securely message the care team. It allows people to access their current care plan and indeed their care record. It allows individuals to see their appointments and to have appointments fixed. It allows people to keep track of their mood and sleep, and it provides free online access to trusted health resources. So again, the number of people within the organisation using this has been quite low, but through one of our weekly broadcasts, we were able to talk all about Beth. The people who've been developing it came onto the broadcast to spread the message and to attempt to improve uptake of this really quite impressive and important innovation. So there's a lot there that I think has been encouraging in terms of an NHS mental health trust. But I also should say a word about what ZenZone has witnessed. So I think one of the attractive things about a platform like ZenZone offers is that it means that there's an enormous amount of data from regular usage by thousands of young people across the country. They've got contracts with, I think, about 85% of CCG. So there's quite a significant cohort of young people in particular where they've got reliable and valuable data. And so through the COVID crisis, they've been able to see what issues have caused greater concern, such as, for instance, domestic violence, what might actually have improved for young people. And, the issue of bullying appears to have actually declined somewhat because they've had more protection at home than they would otherwise do. And indeed, the fact that children have been able to spend more time with their parents, eating around a table and so forth, have been positive. So it presents a mixed picture, but the data is absolutely invaluable in driving practice in the future. But I think also the important other aspect of this is that at a time when access to traditional mental health services has been severely limited, enabling young people to get access to support digitally, to valuable information, videos, but also to go into moderated chat rooms, but to have one-to-one access to counsellors. That all, I think, in a way demonstrates that digital comes into its own at a time like this. It's never going to be enough on its own, but as part of a package of provision and support, it clearly has demonstrated its value during this period. Looking ahead, what are my thoughts? Well, first of all, I think the COVID crisis has been a period where the risk factors associated with mental ill health have been worryingly present. So if we think about isolation, loneliness, money problems, anxiety about build-up of debt, unemployment, bereavement itself, the risk of domestic violence increasing during this period, as we've seen from the data, and also the risk of abuse of children behind that locked front door where schools are unable to identify the telltale signs that they normally do to be able to make a referral through to the police. So all of these things have been present during this period over the last few months. And I think what that indicates to us is that there is likely to be a psychological fallout from this COVID crisis. And that sense is reinforced by what we know from previous recessions and previous pandemics. The combination, of course, of an economic crisis with a health crisis is to some degree in the recent past unprecedented. So if you put all of that into the mix, I think the risk of a psychological fallout is significant. And if we are wise, we ought to be planning for that now. So I, together with many others, including Warren Larkin, a leading psychologist who's focused on trauma-informed care, we've made the case to government for what we've called a resilience task force to be established so that we can plan what we call a public mental health response to this COVID crisis, avoiding pathologizing, particularly young people, but tracking levels of distress in communities. There's loads of data out there. Just one example, non-payment of council tax. If we track the wealth of data that we have of what's happening in our communities, we ought to be able, through collaboration, through mental health trusts working together with local authorities, with community groups, faith groups, third sector organisations, we ought to be able to identify increasing levels of distress and then intervene earlier than would normally be the case to prevent crises from occurring in the first place. And at SLAM, South London and Maudsley, we took up this idea of the importance of preparing now for a public mental health response. We organised what we called a prevention summit. We did it jointly with local authorities. We had over 1,000 people in our 4 boroughs signing up to participate in that summit. And that has now initiated a 1-year programme of work, collaborating with all those local partners to track and to respond to growing levels of psychological distress within our communities. That's the sort of approach I think we need to be taking as we come out of this COVID crisis, together at a national level with a sort of psychological plan, a recovery plan initiated by government to support localities in doing that vital community work. In the longer term, I wanted to say something about what I think are the priorities for change within mental health. And if I look at the landscape now, what I see is a system that still too often institutionalizes people, that denies people their human rights. We tend to lock people up for longer than the international average. That's particularly the case with children and young people. The length of stay in CAMS beds in England is 60 to 70 days on average, whereas if you look to Australia or Canada, it's more like 10 or 11 days. That's not to say that they're doing everything right, but it should at least raise questions about the approach that we're taking in this country. I think too often we re-traumatise young people by keeping them in institutions for, in many cases, too long, making it harder to reintegrate with school, with friendship groups, and so on. And if you then think about the extent to which restraint, bluntly the use of force, is endemic within our mental health system. If you think about the use of the Mental Health Act, which is in effect compulsory detention, this has been on the increase over recent years. And you think then about the disproportionate impact of these restrictive practices on certain ethnic groups, particularly young black men, you end up, or at least I end up, with a conclusion that the current situation is not acceptable and needs to change. And if you look at how other countries do things, I visited Trieste in northern Italy before the lockdown at the start of this year. In Trieste, they have a very different approach to mental health care. They lock up far fewer people. Their whole approach is community support, early intervention, avoiding institutionalizing people. I think that's the direction of travel that we need to take. And to be fair, it's consistent with NHS England's community mental health framework, which is supposed to be a guide to whole system redesign. So the emphasis of national policy is to shift from institutional care to community support. I strongly endorse that direction of travel. I regard it as an unfinished revolution in mental health. I think that we still too often trample over people's human rights. We institutionalise people. We don't put enough emphasis on an ambitious approach for people's recovery, getting people to a better place. We need as a system, I think, to focus far more on prevention, on early intervention and on recovery. We need to shift from institutional care to community support, crisis prevention, but also crisis support where necessary. And I think if we were to embrace that journey of change, then we could use the resources that we've got more effectively to enhance people's lives, to empower people to lead good lives, happy lives. That's what the system should be aiming to achieve for people. And all of it needs to be driven by data. Data is absolutely critical. When I was minister responsible for mental health, I used to get very frustrated that I talked about how I was operating in a fog. There was a horrible absence of data in mental health. We need to understand what's going on. We need to inform change by an understanding of what's happening, and we do that through data and embracing a digital approach, both to supporting people but also understanding the services that we provide. An informatics approach, I think, will drive change in the right direction. So I hope that that's been of some value to you, but thank you very much indeed for inviting me to participate in this conference. Thank you.